Good morning, good afternoon. My name is Lena Rogovin. I'm the Senior Digital Health and Life Sciences Analyst of Startup Nation Central. Startup Nation Central is an independent Tel Aviv-based NGO with one big goal of strengthening Israeli innovation ecosystem by connecting it to the global players. We have a very wide and important topic to discuss today: neurological and mental health in post-corona era. On the one hand, lockdowns and social distancing have made us feel more anxious, lonely, stressed, emotionally exhausted. Anxiety and depression rates double, even tripled globally during the COVID pandemic, according to various sources. On the other hand, technology has been quick to respond to the new solutions. First, there's a number of digital therapeutics and consumer well-being solutions that have seen increased adoption that can help to partially deal with the problem. First-time downloads of top 20 mental health apps were up 40% already in April 2020 compared to pre-corona. There is also a number of existing and new remote diagnostics and remote monitoring solutions, helping to reach out to the most vulnerable populations and improve mental and neurological health outcomes. And there's much more. Today, we have these 5 amazing startups with us to talk about the lessons learned over the past 1.5 years of Corona pandemic. Each of these startups is active in different areas of mental and neurological health domain. And I'm honored to be here. And let's start with the introductions. Ziv, do you want to start?
Yes, with pleasure. So I'm Dr. Yekutieli. I'm the CEO of Monfort. We provide remote patient monitoring for neurological and psychiatric conditions.
Thank you. Nathan?
Hi, I'm Layton Intrator, former professor at Tel Aviv University, founder and CEO of Neurosteer, and we are innovating brain sensing technology.
Boaz?
Hello, everyone. Thank you so much, Lena, for this invitation. My name is Boaz. I'm founder and CEO of Wisdo. Wisdo is the best practice app for social health, and we've demonstrated that we can decrease illness by 25% just by improving the social circle around specific people, including patients.
Amir?
Hi, everyone. My name is Dr. Amir Geffen. I'm the VP Business Development for MoodKnight. We are using artificial intelligence, machine learning, and natural language processing technologies to detect and analyze mental distress in digital content.
And last but not least, Adam?
Thanks, Lena. Hi, everyone. My name is Adam Layton. I'm the co-founder of Digi Therapy, which is an online platform providing digital tools for mental health care professionals to enrich and improve the quality of sessions, predominantly at the moment based on digital therapy cards.
Thank you. Since we basically have 2 groups of companies here, neurological health and mental health, let's start with neurological health. My first question is for Ziv. What are the current limitations to providing optimal neurological care? And what you have learned over this pandemic time?
So for the most part, I believe that there are 2 main limitations. First of all, the treatment is based upon short and infrequent clinical visits. This means that everything is done based on, not based on the natural environment, natural life of the patient, but what happens at the clinical visit. That's already a problem because most of our lives were outside of the clinic, and the short time that we go to the clinic doesn't really represent our real daily activity. And the second problem is that when you do get to the clinic, a lot of the evaluation is done on a subjective manner. So both neurologists and psychiatrists often rely upon their subjective impression from your movement, your mood, your cognitive status. There are very few technologies that are used even in the clinic. So you get a seldom and usually inaccurate evaluation of the patient. When you use remote patient monitoring, digital platforms for remote patient monitoring, this allows you to close the gap between the patient and the physician in the patient's natural life, and doing that in a quantitative manner. During the COVID, the situation was even worse than usually, because even these limited visits were prevented. And in many countries under lockdown, the patients and physicians couldn't meet at all, not even on a quarterly basis. And as a result, the patient's condition was worsened. And where we participated, like in the US and in Brazil, in Italy, when you are able to provide the physicians with proper means to remotely evaluate the patient condition, you allow the treatment to continue and even improve.
Thank you, Ziv. Nathan, you are somehow in the same domain in terms of top level. Do you share what Ziv just said, and what is unique about Neurosteer's approach to the problem?
Thank you, Lena. So we all know that the key to brain assessment and monitoring is a portable and wearable brain sensing, just like the Holter needed for cardiology monitoring. So Neurosteer is replacing the cumbersome century-old EEG with advanced electronics and signal processing that's enabling a medical-grade sensor with only a single EEG channel, namely the smallest possible sensor. This is, of course, easy to use and even at home, and this is why it's also, of course, related to COVID patients and to the recent pandemic situation. So Neurosteer develops a platform based on this sensing technology and brain interpretation for three pillars: continuous monitoring, assessment, and neurofeedback. For monitoring, we are going after ICU patients, initially the ventilated ones, to reduce the so-called post-ICU syndrome. And we all have seen from COVID how the brain damage that occurs, especially in ICU cases, can last for a very long time. For assessment, we are going after potential massively deployed solutions for very early detection of neurological and neurodegenerative disorders such as Alzheimer's, Parkinson's, and frontotemporal dementia. So this will go to the general physician and later for home. These are the two major current efforts that we have, and there are clinical trials to validate that. For neurofeedback, we are currently developing a comprehensive home management tool for chronic conditions such as stress, depression, and some cases of chronic pain.
Thank you, Nathan. This is very interesting. My next question goes to Bose. Bose, you are addressing some of these issues and some other issues, but from a different angle. Could you please share what you've been in the market for several years already? What do you see over the past couple of years? What have changed in terms of what your users are looking for? How are they trying to engage? And what is the feedback in terms of outcomes which you receive from your users?
Great, that's an important question. Like you said, we've been around for a few years, and when we started this whole argument that social networks are great for some things, but are not necessarily the best place to go to when you're trying to move towards health. was kind of a claim that we had to work hard at explaining. That is no longer the case. So the trend, both in terms of how consumers view social interactions online and how very large-scale US-based healthcare organizations view the connection between social interactions and health, these two trends have been accelerating, and COVID accelerated those trends further. We started as a B2C company, just trying to connect people to other people online, not through data points like popularity and similarity in terms of circle of friends, what's called the social graph, but rather to introduce people to other people who answer to two criteria. One is they've been in their shoes to a very large degree of affinity, and second, they've been rated as helpful by other members of the community. That's how we've grown to about 2 million users and hundreds of millions of data points. And then what has happened in the US healthcare market is that very large scale health insurance companies have been beginning to focus on what they call the social determinants of health as one of the primary drivers of healthcare costs. We're in the midst of a large scale project with the top 3 health insurance company in the US, where really the question that we asked together was, can we demonstrate that contributing to people's social health ends up contributing to their physical and mental health? And 120 days into this project, we can now say that the answer is conclusively yes. And we're seeing anywhere between 20 to 25% reduction in various proxies of illness due to the fact that we've been able to introduce people to other people online in a way that makes them feel less isolated, more connected, rather than more isolated and more disconnected. So that's what we've been seeing.
Do they continue using the app after they feel better?
Say again?
Do they continue using the app, the Wisdo app, after they feel better, or they stop?
Yes.
Okay.
Yeah. So they join where often they join where they're experiencing a moment of isolation. They experience relief when they join, experiencing the sense of, wow, I can't believe that these people exist and they understand what I'm going through, and it's not a popularity contest. And then they stay on primarily for 2 reasons. One is to open themselves up to additional experiences and conditions that weren't why they joined in the first place. So if it's someone coming in with a preoccupation around anxiety or depression or stress, they might stay on for things like relationship advice and improving sleep and getting motivated, and then it becomes part of their profile. And the other circle of retention, or the retention driver is, and I think it's really interesting to the people on this call, is helping others. So anywhere between 20 to 25% of people who join Wisdo to find relief step up and become what we call helpers, beginning to offer support, understanding, and a kind word, not medical advice, but just understanding and sympathy to people who join. And 91% of them are still active 12 months after joining. What's even more interesting is when we look at the data in terms of quality of life, often the helpers are the ones that have the highest degree of illness and the biggest reduction in various measures, which seems to suggest that helping others is one of the most therapeutic things that a person can perform. So we're trying to help in that respect.
That's amazing. Thank you. Amir, question to you about AI. How do you do it? Like, it takes mental health professionals like years and years of learning and practice before they know how to analyze mental distress, how to train the machine. Did the current situation, the COVID situation, create new opportunities for digital mental health technologies, or this was just like one-off thing which will somehow fade away?
Okay, so again, hello everyone, and thank you, Lena, for those good questions. I would say that the short answer is absolutely yes. Yes, we can train a machine to detect and analyze mental distress. I would say as good as well as a professional can do. We have a 90% accuracy in doing it. We are doing it using the most advanced technologies of artificial intelligence, machine learning, and specifically natural language processing that is trained by mental health professionals. So we are using all those years of studying in order to train our machines. The keyword that you used is really train. We employ a team of clinical psychologists that train the technologies by providing it with tens of thousands of professionally annotated text for mental distress. And this tagged data set is used as a training set for the AI, machine learning and NLP technology that will develop to detect and analyze similar distresses now automatically on its own. And as I said, we reached a very high accuracy level of 90%, meaning that our technology can properly classify 9 out of 10 texts and analyze for its mental distress. Now, as you asked, during COVID and of course now post-COVID, we see a dramatic global increase of about doubling, okay, in the level of mental distress, sometimes higher. It's stated everywhere in the media, in academic research. So with that, the mental health authorities and helplines, for example, are flooded with calls and are struggling to provide proper service. For example, we know that children with suicidal ideations could today wait weeks, sometimes months, before they can see a public psychiatrist. So our technology, we cannot invent more psychiatrists, but what we can do is that we can really help the authorities and the industry to better prioritize this massive flood of mental distress, and then using our technology to refer the right cases, the proper cases based on their severity to the proper support organization.
Thank you. Adam, you are actually transforming this traditional psychotherapy industry, and remote psychotherapy consultation is a breakthrough by itself, but there are obviously many tools which can potentially develop and develop this further. Could you please provide us some examples of what's in there and where it could go? Thank you.
Okay. Well, first of all, I actually want to start with the most basic things. We're talking about enhancing our online presence. And one of the things we're trying to overcome is first of all, the lack of physical body. And that starts with the most basic things, even knowing how to build the right setting, moving away from your camera so your body is more present and you can see not just facial emotions, but also body language. So there's a lot of knowledge involved here. Once we move to the digital presence, then we have other tools we can engage. We don't have to just duplicate what we're doing in a clinic. We can add additional things. One example, that's part of our offering, is the move to cards. Therapy cards are a very powerful tool. Metaphoric cards have been used for years and years in therapy, both during traditional therapy and coaching. And once this moved into the COVID era, we lost our ability. You can't have physical cards on a session. It's impossible to see them. So what we actually developed is a whole platform, starting off, first of all, offering digital cards, which can be manipulated, which provide a very collaborative experience. I think one of the changes in psychotherapy in the last few years, CBT has been a strong push in that direction, is a very collaborative approach. So I can actually give the patient during a session the ability to control the screen, to manipulate the cards. We can use in lots of different modalities. We've got a protocol based on CFAR CPT for PTSD therapy. And we have 15 different types of decks for different uses for ADHD. And a unique approach we've also included, based on this concept of being very collaborative, an equal sitting with the therapist and the patient, we now have questionnaires which are done through cards. So instead of, for example, the traditional setting where I, as a therapist, give a questionnaire to a patient, it almost feels like an exam. We now use our cards with the same questions, but then the patient just takes the mouse and can start using it during the session, filling in the questionnaire in a much more playful way. So what we've actually done is we've not just taken an existing tool which therapists use, we've enhanced it, we've increased it, and now we're giving tools which can be used both in session, in online sessions, and also in physical presence. What we're finding now, and I think we're actually quite excited, is that a lot of therapists are starting to use the tools they adopted during the COVID period and bring them back into the physical presence. And I think a lot of the tools mentioned here among the different participants are also going to manage to find their way back into the traditional clinical area. And the fact that they've been using remote therapy will actually help them. The fact that we are willing to connect digital tools to therapy, which 2 years ago would be heresy, is now becoming much more accepted. So that's one example of sort of tool. We're now increasing forms. You can be using digital therapy cards with a therapist. Therapist is still the main part of this activity. And we can have forms will be saved. You can actually manage the whole sessions through this platform. And it's part of a vision we have. We really see integrated platforms which can both provide tools during the session, both online and in the clinic, because we believe this has to be a very natural transition. We're going to have, so we could call it hybrid therapy. I'm going to have a session in clinic, and next week, because somebody's traveling, he'll do it online. And the next week, there might be another pandemic or another reason, so we can move in and out of clinic. And the tools have to be able to move in and out of the online back to the clinic. And also the platform we want to see in the future, including between session activities. And again, a number of the participants here talked about products which are very suitable for between sessions. It could be social platforms, it could be monitoring, it could be, for example, another colleague's developing reminders which can resonate the activity, because as Ziv mentioned, life is what happens between sessions. It's not what happens in the clinic. That's just a small part of it. So that's very, very briefly about the kind of products, kind of activities we can do in this platform.
Sounds really great. And yeah, it's really helped the process. We don't have much time left. This is a huge topic, and we can discuss it much longer. So we have time for one question, which I want to ask all of you. Like, very long-term vision. What can digital health as an industry do for improving quality of mental and neurological care? Who wants to start? Adam.
Okay, in a nutshell, I'll try and do it in 60 seconds. Integration. We're all walking around with these wonderful devices, and again, a lot of the products here are relevant, which can gather so much information. And if we could integrate this information, we could constantly monitor our effect. We could practice at home, keeping our default mode network active. We could use biomarkers to monitor our gait and see if we're in a good mood. If we could integrate this as part of the activity between sessions, and at a later stage, as education, we could use these platforms to educate ourselves. And it could even start at a much earlier age. It wouldn't necessarily have to be part of therapy. So gathering all this plethora of information, of data from different sources, but predominantly from what follows us day by day, integrating it, using common backbones, and dealing with the biggest challenge, which will be trust. So we have to have some kind of global watchdog which will create trust, allowing our users to be willing to use these incredible products between sessions during our day-to-day life.
Thank you. Who else?
I will add to that I believe that in general, chronic conditions will be treated remotely almost entirely, and people will need to go to the clinic and hospital only for severe cases or when special equipment such as MRI is required or going through operations and such. And not only that this will improve the patient quality of life and allow early detection, etc., it will also reduce a huge amount of money, costs that we're all paying in taxes to pay for this lack of efficiency, which represents the current status of the medical services we obtain.
Yeah, I can add to that, and I totally agree with what's been said right now. I'll just add two more things that I think are important. One is, I think that going back to the issue of trust, I think what has happened is that more and more people, including age groups that previously were seen as outliers, feel more comfortable with using virtual solutions, and I think that's going to increase. Remember, COVID is going to end. I know that it's a heresy to say that because many parts of the world they're still struggling, but this will be over. What won't be over is this trend towards more and more age groups feeling comfortable with technology, including people who are now in their 50s and are going to be in their 60s in 10 years, and that's going to affect costs as well. Just the ability to reach out to them remotely, regardless of COVID. The second thing that I would say is that because that is the issue and the situation, we're going to have more data to play around with. And here I agree with Amir, who will probably say that the key here is prevention. Because if you have large data sets that have been gathered by people who feel more comfortable using virtual technology, you can be more efficient in sort of staying one step ahead of that person and saying, well, here's something that you should know about, or here's something that you should do, because we know something that you don't know, which is that you might be heading towards a less healthier place. And I think that prevention is going to play a very big role in the next 10, 20 years.
Let me add a couple of points related to accuracy of the assessment. I believe that technology based on miniature advanced electrochemical sensors, something that has been really advanced in the last few years, and advanced electronics and signal processing together with AI will actually bring to the home or to the general practitioner technology that can revolutionize the ability to early detect and manage different neurological disorders. 30 years ago, we used to say that a person has cancer, and the assumption was, well, there's a single type of cancer and single type of drug to treat it. We all know today that this is totally different because we have genetic ways to look at different types of cancers and so forth. I believe this kind of revolution is needed for neurological and mental disorders so that we can optimize the treatment based on the very specific changes that occur for every specific person.
I will, of course, join my colleagues here. I think we all share the vision that really digital health is changing the entire healthcare industry. And that's, of course, including also the mental health. Now, as I explained here before, we now have a technology that was not available before that can really detect and analyze mental distress on its own with a 90% accuracy level. Now, we see today many online communities and social networks that are really unable to properly detect and analyze those distresses that are publicly shared by their users. So really, in our vision, digital mental health technologies like ours will ensure that no public cry for help and support will continue to be left unnoticed or untreated. So thank you for that.
Yeah, thank you. That's right. So to summarize, in the longer run, we expect first continuous care becoming a standard. We expect almost everything to be treated remotely, and because of that, will become much more affordable. We expect new online apps to create trust and to make people feel much more comfortable. We expect prevention and treatment optimization driven by data and improved accuracy. And overall, we expect technology becoming more advanced to make all this possible. Thank you so much, everyone. This was very, very interesting, and all your solutions are amazing. And It's great to see that there's so much being done and yet to be done to improve people's quality of life and people's mental health. The timing sounds right for a breakthrough. Best of luck to all of you. Have a great day, and thank you very much.
Thank you so much.
Thank you very much.
Bye.
Bye-bye.
Bye-bye.
Bye.
Bye-bye.